Very good morning to all of you. It's pleasure to be here with all of you today morning, and it's really heartening to see very busy professional gathering at this point in time from all over the country. The credit must goes to Ms. Bobby Ramesh and her team, and the chairman of the group, Dr. Rakesh Gupta. To be frank, while coming only, I get to know about this group little more than what I was thinking. The first question that I asked Mr. Ashok, that why did your team ask you to come all the way from Faridabad to Noida and coming back? And I know that nursing profession is very, very demanding. He said, sir, we want to respect our guest. So I think that is the uniqueness of your group. I humbly accept your invitation, and it is a really, really privilege for me to be part of this conclave today. So I have prepared a few slides, but I don't think I'll be able to present those slides in the way I want. But however, I will try to use some of them and then connect the group with what we think from other side. So take me as your customer, not as the expert. So I'll share a few examples of my personal, and then I'll go on to the presentation. Can someone help me with my presentation? Yeah. And before I get into this presentation, I want to ask some of you, because I have seen Miss Bobby Ramesh also done MBA and management, and you were, just before me. I think I forgot. I'm not that good in remembering the names. Nursing head, the speaker that was spoke before me, is also a doctorate, and hearty congratulations, ma'am. Very few people we could see the doctorates in this profession, and it's really happening. Yeah. How many of you are an MBAs already here, or something? Wonderful, good, very good. I think one of the biggest the problems of this profession or this field, healthcare, as I understand from outside. I'm not from healthcare, but of late what I am seeing is a huge opportunity. Do you know which is the largest sector of the world in terms of business? Is the healthcare. 12 trillion. 12 trillion as on 22, not today. And the next second largest is automobile industry, is less than 8 trillion. When automobile can create so much of jobs, how many jobs that healthcare can create? You have already seen, and it is exploding. I must also share with you, the same healthcare space has given me a special recognition within management stream also. So my submission to all of you, so you have to progress in your career. Our career progression is very important. Please do not stop with a single degree or 2 degrees also. Try to go out of your basic qualification like nursing. Nursing is already, your foundation is nursing. So my sincere appeal to you, all of you, just try to do something more than nursing, preferably in management area. That's the reason why I asked how many of you are MBAs already. Right. Okay. Right. So I also want to share a few things in continuation of my previous speaker. There are the communicable diseases, non-communicable diseases. Do you know what is the third disease? Do you know what is the third disease? I'm basically a teacher. I like interaction. So though it is a very important morning session, but I want some of you to interact with me also. Yeah. What is the third type of disease? Communicable diseases, non-communicable diseases, fine. This is the basic classification of diseases. There is a third disease. You know what is that? Any idea? Lifestyle disease. Lifestyle disease also comes under non-communicable disease according to me. More specifically, I call this as a technology-induced disease. We have the disease called mobile phone disease. You can see now, while listening to anybody also, you will automatically, your hand and eyes automatically goes to your mobile phone. This is a big disease. It's really a big disease. There are technical names also for this. I don't want to get into those details. So I think you have a great role to play to prevent these kind of diseases as well in the society and of course in your this thing. Now, I'll ask one more simple question. Innovation. You know what do you mean by innovation? Because the basic theme of this conference is also innovation and collaboration. Collaboration everybody knows. I want you to answer this innovation. Give me an example of innovation. Innovation. What do you mean by innovation? There is no fixed definition of innovation for your information. Improvisation is a simple example of innovation. I'll give you one quick example of innovation which comes from bottom of the pyramid or bottom of the or grassroots level. Innovations will not come from the top. Innovations will come from the bottom, particularly the work level or the people who are involved in the workforce level. I hope, is there anyone who do not like ice cream? Everybody like ice cream, right? Right. There was a biggest problem of waste management generated through ice cream cups. The CEOs of big companies are all joined together and they were not able to find a solution. The lowest of all these people, the people who serve in the meetings, the boardrooms, they're expected to be the least educated and the least known in terms of what is happening in the meetings. Do you agree? So one such gentleman was serving the team, observed this, lot of hue and cry for finding the solution, a waste disposal problem. This gentleman said to one of the experts that if you throw the ice cream cup, then there is a problem. Do not throw. From there, cone ice cream came, my dear friends. The cone ice cream has not come from anybody, the big people, like what Madam said, product development. The product development comes from, medical products comes from you people. I am going to quote some of the examples. It is not something uncommon, it is very, very common that great things and good things come from small things. I'll give one more live example. Please spend your time as much as possible with small kids, not as the patients, but as the kids at home. I have learned a lot from my kids, and so as many of you might have learned from your experience also from kids. So that is the source of our learning and innovation sources. There was a program which I was conducting in IIM, and one of the participants was from Sony Group. I hope you all know Sony, right? Sony is famous for innovation. Sony is famous for innovative products. The Sony camera is the lightest and the smallest, thinnest camera in the world as on date also. This camera came from the product development team by focusing on very, very small things, very small things. The product development team was working on this problem for quite long time, but they could not find the solution. The CEO found the solution, and the CEO found the solution, then called for a meeting, then asked the design team to bring one bucket of water and the latest camera that they have developed. This was demonstrated in my class by the person who was involved in the product team from Pune. And India is a great country. We have a lot of innovations, innovation centers, R&Ds that are happening, particularly medical device. I am going to quote a few more examples from GE also. This guy put the camera into the water. He found water bubbles coming. What do you mean by water bubble coming from the camera? There is a gap. So fill that gap. Now it is your job to fill that gap. That is how the latest Sony camera evolved. So I'll stop for such examples and I will go through few of the things quickly. Yeah, right. Next slide, please. Next slide. Or should I use my computer? Yeah. This is my journey. I am not a medical professional. I am basically a mechanical engineer with industrial engineering. I am not even MBA. Let's tell you honestly. I am an operations person with the industrial engineering background. I also studied from Kerala. So I am happy to see many Keralite in this profession, right? And apart from this, what I cherish most important thing is I am a half marathon runner, 3/4 marathon also I completed, and I am trying for my full marathon. And I see a lot of doctors participating in marathons also. I work with doctors, so that make me to be fit first of all, and the rest. I think this is secondary for me, and let me move on to the next. Yes, please. Next slide. Yeah, this is the outline, and next pick. I already shared my personal experience. Yeah, next slide. Or is it possible to have control by me? Yeah, okay. So India is a great country, as you all know. India is having a lot of distinctions in terms of whatever that you can call, but our health indicators is also, as indicated by my previous speaker, that 147th in the list. So this is worse. And let me also tell you, our Kerala health indicators are better than US indicators, ma'am. This is for your information from the same report, right? Kerala is the best in terms of health indicators, which is better than your United States health indicators, right? So the point here is that we need to go a long way in terms of health. We can achieve 5 trillion or 10 trillion economy only by focusing on health and education. These are the two things which economists are saying, everybody else is also saying. Health is the prime requisite, right? So he is a famous people's president. What he said is that you can only become developed country only by focusing on health and makes it available to all. Now the problem. Health is the problem for everybody, right? What you have seen is here, if you look at among all work areas in healthcare, nursing care is the serious shortage, and the reasons are also well known. And lack of progression, lack of incentives, lack of lot of things. So it is now the job of creating those opportunities for the chairmen like Rakesh Gupta and all. Sir, I sincerely appreciate your efforts in making this to happen. I think this is a wonderful initiative to show that right path. And you already know these 4 years or 5 years or 6 years, there is no limit on years. Lot of years are there, C's are also there. So my point here is that there is a lot of areas where we need to progress or improve in the healthcare delivery. Particularly, I would say more than access, it is the awareness. A lot of people don't know what is the health indicators, the health status of the people. Yes. So this is not new. I always say that there is a north-south gap. North-south gap does not mean that North India and South India, which is true for the global south, global north gap also. The same thing is true for, even if you take a village, the northern part of the village is different from southern part of the village. The gap is natural, so the bridging that gap is very important. What you see here is that there are a lot of such changes that are happening. So there are some innovative programs that are happening. all these programs are also has become integral part of election agenda today. As you can see from Andhra model, and where there is a comprehensive health network is available, and a family physician visiting the village level, and Tamil Nadu is a pioneer in terms of making nursing care available at doorsteps of the village residents. So that is what is the commitment by the governments as well as private. So what I want to convey from this slide is that there is a huge opportunity. Let me also tell you, I come from a business school. There are a lot of entrepreneurial opportunities for nursing care, more than doctors, I must tell you honestly. Though there are few doctors here, including your chairman is a doctor, but the doctor profession is much costlier compared to nursing, and a lot of entrepreneurial opportunities are also there. That's what is the point I want to convey here. Yes. So on one side, we have a lot of gap. As you can see, the best and worst of the country. We are sitting in Haryana. Now you see this here. In terms of doctors, we don't have such numbers for nurses and other cares also. So what I want to convey here is that we do not know what we are in terms of some of these elements of the care. Right. So I'll skip some of these things because you already know these issues, what is happening to the elderly care and home-based care and so on and so forth. So the focus resources on communicable and chronic diseases such as diabetic and cardiovascular conditions and so on and so forth. And the other thing that I want to convey from business point of view or management point of view, that all models are changing. The capex to OPEX to pay as you wish. And now the day may not be far away. If you get hospitalized, you may get paid. Seriously. Because you have such a disease or such a condition that somebody may be interested in doing research on you, for which you may be paid. That's what I mean, right? So, you know which company, which organization, healthcare organization model based on pay as you wish? Anyone? Can you name? Which is that organization? Pay as you wish. Absolutely. Even today, no appointment is required, walk in, you choose, no questions asked, no verification of documents, you come in the free or paid. That's all. Self-decided. You talk about patient empowerment. I would say this is the world's best way of patient empowerment. So that kind of, and if you look at their balance sheet as well, and they are into 30 to 40% EBITDA. So that is also not a joke, okay? So that's the point. So here we have a lot of changes that are happening, family physician, AP model and so on and so forth. You name it as Tamil Nadu or Andhra or Telangana or any part of the country today, a lot of innovations are happening in the healthcare space. So that's the point I want to drive, right? So there are a lot of things that are changing, including COVID, thanks to COVID, since our agenda is digital. Why digital? If you cannot meet your friend, can you call? So that is where this has changed the way the world has delivered the healthcare. Particularly India has become the number one in that. Ma'am, I agree with you on health indicators in terms of global level, but in terms of digital, including digital applications in healthcare, we are on top. But we don't have enough data to submit or to prove that. Yeah. Right. I'll just quickly go to my the most important thing. Technology as the enabler. Tell me what you cannot do without using the technology today. Be it mobile phone, be it anything. These are without technology there is no life. I would say your survival is completely linked to the technology today. If you forget the phone at home, you will feel that you lost something, right? So that is what is happening, and particularly in medical. And what Apollo expert has said about technology is in front of you, right? So I have already talked about Arvind model. We have a lot of such models where we can take it for granted how to use this, either GE model, Arvind model, or Narayana Health, and so on and so forth. There are plenty of such examples available. I want to convey this GE in Bangalore. In fact, I visited that, and today they are using design thinking, empathy. That's what you're already, and nursing care is meant for that, and you have a great contribution towards that empathy also. I'll share some small examples on how empathy has led to the development of Lullaby baby warmer at Bangalore GE. So Narayana Health is another example. So we have such wonderful innovations. And here Stanford University, working with AIMS Biodesign, they also developed a lot of innovative products which you are already aware. So there is nothing new. What I want to convey from this is small innovations that are happening, be it Jaipur Foot, Jaipurni, or Embracer, and maybe GE's ECG machine, and so on and so forth. The point of care devices, a lot of changes that are happening. In this product development and design and delivery and use of these things, the role of nursing or nurses and nursing care is immense, so that you already know. Right. So this is one such example I have been demonstrated by the product design group at GE. The way they have improved the product from the version 1 to version 4, Lullaby, the way you carry the baby and you put the baby into the warmer, and the corners, the sharp edges were replaced with the round ones, and so on and so forth. This is one best example of your involvement in coming out with a world-class product by the world-class organization called GE Medical, and this has been developed at none other than Bangalore GE Labs. Okay, that's the point I want to convey. All right. So there are a lot of other changes, challenges, or technological advances that are happening, be it drones or any other thing. And what I call this as the supply chain, the power of the supply chain through technology, that's also happening, as you can see. And I have seen in the introductory video also, while I was sitting here for a while, that your group is also doing a lot of technological innovations in that. Yeah. So you mentioned about the changing models of care. So this is what is the changing models, tele-ICU. You should be able to educate your customer by sitting remotely. So the challenges are very high, and for that need to be trained, or in that area, a lot of training is also required. I must tell you honestly, the language itself is a big barrier. You can connect to a patient in Andhra. Let us say I have my mother who is about 80-year-old now, and she is a little bit immobile now. I want to take the help of nursing care, but the language is a big issue. So including the language part, one of the biggest drawbacks or the barriers in healthcare is that a doctor or a nurse from south cannot easily be able to practice in, let us say, in NCR, because here the language and the culture is different. So like that, there are a lot of such things that you need to be educated in care delivery in the changing needs. So that's what I want to convey. Now I will go to some simple examples. What do you mean by innovation? Is there an opportunity? This is a newspaper item. It is not from any book. Is there an opportunity here? Yes, what is that? Bindas. Opportunity. So your job is to identify what is the opportunity. Even if there is no customers, is there an opportunity? Yes. You create a resource and automatically the customers can come. I'll give you a very simple example of what I did just few months back in my own capacity. On a highway, there is a petrol pump, and next to the petrol pump there is a restaurant. You know, the restaurants makes more money than the petrol pumps on the highways, right? Which is common everywhere on the world. Next to restaurant, what more you can put? Is there an opportunity? Yeah. I asked my friend who was interested. I put one dairy parallel, which is also doing very well. So where there is no opportunity exists, you can create an opportunity. So that's what's the point I want to say from this slide. Right. So put all these things together. You may be thinking that it is the product innovation. You see this? The product innovation. There are a lot of products that have been developed. I quoted a few examples. And process innovation. Arvindaya Hospital is the best example of process innovation. Service design and delivery innovation. These are the another two types of innovations. And we are operating all this in the regulatory ecosystem. You have to follow NCM guidelines or other guidelines and so on and so forth. Most of these things will not change. Whereas the business model of the organizations have to be changed. So that is the point here I want to convey. I can quote a few more examples, but in the interest of time, I am going to stop here. That these are product innovations, process innovations, all those innovations are also very important. But more than all these things, your business model innovation is very important. You know what do you mean by business model? For your Sarvodaya, the business model is very important. The nurses are there, technologies are there, doctors are there. But the way you align all these things together to make the difference is the business model. I will not get into the details of this because the nature of this session is different. So what I want to convey is there is a need for continuous change in your business approach or business model. Yeah. All right. So when we talk about collaborative innovation, you have seen. Have you ever thought that Agua ventilator, do you know who is the Agua ventilator, Agua healthcare founders? Is again my good friend, Dr. Deepak Agarwal from neurosurgeon AIMS, and this gentleman Divakar Vaish. They became collaborator with Maruti. Have you ever imagined that automobile company is going to be a collaborator, big conglomerate, a big automobile company is going to be a collaborator with a small startup called a medical device manufacturing company like Agua? Have you ever thought? Let me also tell you, I am also instrumental in bringing these two organizations together, I can proudly say here, because the Maruti guy who was involved in this is my student. And the doctor is my friend. Don't waste time. My son came from Italy at the peak of COVID wave 1. He was studying in Italy. I told him, just leave your baggage, come with a simple briefcase, not even suitcase. I booked the ticket, I asked him to leave in half an hour time from Italy, Rome, hub of COVID-1 as you are aware. The life is very important, studies is like secondary. I said, Jine to na. Education is required only when you have a life. So I said, pack up, don't even worry about it. I booked the ticket, he flew and he came. We all talk about empathy and all these things. So let me also tell you, you know, you have gone through. Healthcare workforce was the worst affected during this COVID time. They have not been treated by the neighbors. Including the doctors and nurses in their own homes, they have been treated very badly by the neighbors. You all have seen that. I have not gone through less than that. I have also gone through that. Since my son came back from Italy to campus, nobody spoke to me. Nobody. Rather, I became a subject of discussion. Subject of discussion. What I want to convey here is the crisis makes you different. Crisis makes you different. So that's the point. So in this crisis, that day, I called my doctor friend what to do. He replied midnight, 12 o'clock. He said everything is fine. Then I asked, I put him in isolation. Then I asked what is happening to your ventilator. Then he said there is a flood of orders, but we don't know how to scale up. The biggest problem is scale up for these companies. Then by the time I read the automobile news, automobile companies have shifted the game. My own PhD student, so no problem. I connected both of them midnight in February 2020, I think March or so. Then in 24 hours to 48 hours, government order is in hand that Maruti is going to assemble these products. So what I want to convey is the crisis brings people together. That's the point, okay? People change when your survival is at stake. When your survival is at stake, people will change. So that is the point. Yes. Okay. So you need collaborative technologies and processes and collaborative innovation. We named this collaborative innovation way back in 2015. Collaborative innovation as the workshop name for our healthcare project. Okay. So I would skip this. Now you come to optimization. Last 2-3 minutes I will spend this and I will close my session. What do you mean by optimization? Optimum care. The best use of resources. The best use of resources is optimum care. I have 2 nurses. I need 3rd nurse. I don't have. What should I do? How do I do this? So that is what is my forte, being a operations management interest in the area of operations management. Our approach is to optimize the resources. Digital technologies, digital transformation is the biggest enabler for these changes. That's the point I want to convey. And here, the best use of all resources, including time is the case. And this nurture scheduling problem is one of the oldest problems of the world that have been addressed by management professionals and particularly academicians. That's the point I want to convey. Here you have schedules that requires excess hours. Can you reduce the excess hours schedule? And scheduling time required by the nurse managers must be minimized. So these are the objectives where you can reduce your nurses, or rather scientific approach towards that. The one point I want to convey here is that the management science approach or operation research, computer science and other approaches have been utilized in the healthcare. You talk about healthcare #1 organizations like Cleveland Clinic or Ohio, the Mayo Clinic and others, they all became better by using management science approaches into their practices in terms of planning and execution. That's the point I want to convey. Right. So this is a simple example of don't get afraid of equations. People, particularly medical professionals, healthcare professionals, they are afraid of equations or mathematics. So please put in simple equations into your profession. You can do wonders. This is the single one slide that I use for minimizing or optimizing the number of nurses that are required based on the requirement on everyday basis, including which 2 days that nurses or nursing staff have to be given the consecutive days off. So there are mathematical models. What I want to convey, there are mathematical models available for optimizing the scarce resource, so-called nurses. Right. So you have a number of such examples. What I want to convey in this slide, the number of such examples around the world, including Columbia Hospital, Community Health Center, where you can see that this increased the number of clients care by 9 per week. 9 nurses saving in a week. Is it not sufficient? You can make your chairman's balance sheet much stronger. Right? You talk about incentives, poorly paid. Poorly paid means what? The poorly performed. You try to improve your operational efficiency, automatically you will get benefit, and your organization balance sheet becomes better, and thereby you can get better incentives and so on and so forth. My next time when I want to see this conference, I want to see that incentive systems for nursing workforce. That is very important. Yeah. So there is another example I want to show to you. What's happening? Can you change the slide? Yeah. There is one such Columbia Hospital, Canada also, the similar kind of thing that you can see, linear programming model that I have shown a couple of slides back, that there will be a slide or mathematical model that you can use to optimize the workforce. Because healthcare, the maximum cost is, Madam said, 60-70% of the cost is out-of-pocket expenses for the patient. Whereas for the hospitals or healthcare providers, the manpower cost is more than 50%, as you are aware. There is a large scope for improving that kind of thing. Yeah. Okay, so I'll stop here. What I want to convey here is that there are a lot of changes that are happening, like pandemics like COVID, etc., as the source of opportunity for making the change or migrating from traditional processes to technology-enabled things, but don't forget mathematics behind that. So I'll stop with this, and thank you all for giving me this opportunity. So I wish you all the best, and I also want to share one hospital that we have visited in Denmark, Children's Hospital. The new hospital head happened to be the nursing head. The doctors were reporting to the nursing head. So this is the change that is happening around the world. I'll stop here. Thank you so much for all your patient listening and the opportunity given to me. Thank you.